Welcome to the NewTom tutorial section. Here are some tips to get started using the intraoral scanner optimally in the VisioScan Connect software. Let's begin creating a clinical case, such as an acquisition of a study model. The software suggests starting the acquisition from the jaw. We activate the recording with the Start button and perform the acquisition of the entire occlusal area, making zigzag movements that will allow acquisition of the occlusal part and vestibulolingual references. This will help to have a precise and defect-free model. Once the acquisition of the occlusal area is completed, tilt the device and scan the entire lingual area, verifying the interproximal areas. Lastly, move to the vestibular area with the same strategy, rotating the tip when reaching the front area and, if necessary, also moving to the palate. Once the acquisition is completed, press the Stop button on the device and make sure that the acquired area does not have defects or missing parts. By pressing the Mode button on the device, we move the acquisition to the jaw. This requires two important precautions compared to the maxilla related to salivation and possible tongue artifacts. We try to thoroughly dry the scanning area and make sure to activate the soft tissue removal function on the bottom left of the screen. We repeat the acquisition with a zigzag movement strategy, starting from the occlusal area and completing the lingual and vestibular areas. At the end of each acquisition, it is important to verify the data. We check all areas to ensure there are no artifacts or missing parts. In this case, in the vestibular area of the molar, we noticed a missing area. It is recommended to reactivate the acquisition and fill the gap before moving on to the occlusion recording. The registration of the bite starts by placing the device in the area between the premolars and molars. We bring the patient to closure and activate the acquisition by moving in a zigzag between the two arches. After a few moments, the bite registration will be completed, and it will be possible to perform the acquisition on the opposite side as well. It is recommended not to activate the device before it is in the oral cavity and before the patient is in closure. Otherwise, it is possible to record misaligned data. Once the acquisitions have been verified, we can proceed with the finalization of the model. Upon completion of finalization, the software presents the digital model in occlusion. To communicate with the patient or to check the data, we can select macella or mandibula at the top of the interface. By selecting Finish, the software saves the data in the clinical case. These will be available in the Viewer section and automatically synchronized in the cloud. For other tutorials or more information, we recommend visiting the official NewTom page.